I'd now like to welcome to the floor 𝐶𝐤𝐚𝐳 𝐋𝐲 once again, who will be leading today's panel discussion among the remaining attendees and panelists. Sonia, welcome once again.
Thank you, Franco. Yes, so I think we have a great chance indeed. I have been again moved to the summary that Dmitry has given. I think the book and the story built behind the analytics and the data into biomarkers is fascinating. So I think it gives a good ground for every decision made forward. Do we have some questions from the audience, Franco, that we would like to address first, or how we would do the best? I obviously have some questions for the speakers, knowing all their work, and interest, but maybe we can start first addressing to give the audience a little bit presence. Yeah, we had 150 people or more, even, being very patient with us during all these 4 hours. So maybe there are some questions from the audience we should put first.
It's true. However, I think that the individual speakers that they were addressed to already addressed them in the Q&A box themselves directly. I will check and confirm that that's the case, but why don't we jump into some of your questions, and then I'll circle back if it turns out that there are still unanswered questions from the Q&A. Yes.
Okay, so I can start, from Fedor, because I think let's go through the alphabetical order of of the presentation today. Fedor, we have heard, I think, in your background in bioinformatics, you're the person sitting in between, the biological data and the AI. In my view, you have a big expertise, and you already have worked on several on the aging clocks, which really brings the epigenetic being in the center of the research. So can you, I was just wondering, still we are missing indeed, a connection between the different sources, normalization of the data. What is for you the biggest challenge, in making these products being also widely acceptable, or being scaled to a mass that can make a difference? How do you see, your innovation in that space going to the next level?
Yes, thank you, Sana, for these wonderful questions. Speaking of the biggest challenge to creating the infrastructure for proper, longevity intervention development and implementation for the masses, I believe the greatest obstacle right now is awareness. Since we are the people in the know, right? We work with this longevity medicine thing, with life extension technologies. We know all about it. We write articles, books, and join conferences to discuss these issues. But the general public, they are not that well aware of what is going on. But more importantly, I think that rather than the opinion of the general public, it is much more impactful to influence the opinion of physicians, of the medical professionals, because they're actually the people who can tell, I don't know, 1,000, 2,000 people that longevity medicine is a great thing, and I suggest you start doing this, and here is a number of geroprotectors. Well, you don't know what geroprotectors are? Here are the materials, and if you want, I can explain it to you, because, I believe that the focus on the medical applications and, the medical personnel who are actually going to implement these longevity medicine paradigm into reality, they have the power of, I would not say so much as decision making, not all of them definitely, but informing the people who can see the benefit in longevity approaches and life extension technology. That is what I would say the greatest obstacle and the greatest way to introduce longevity technology to the world.
Okay, so I see we would need to have some kind of educational programs, business to government, whatever tools one can use to eventually being able to clearly share the value proposition and the impact. Is it something that we could do to really show the impact? I know you need to generate the data. It still needs to be some longitudinal data and more data to create that. But do you think that maybe the frequent communications and panels in that discussion? I'm just trying to understand. In one way, I think we don't have the framework, which Dmitry was also mentioning in his book, to really make a structure of the development and focus in the development of longevity biomarkers as the solutions. So, but on the other side, not only financially, I think we also don't have the regulatory framework in that sense, because majority of this type of products, and me and you discussed, and thank you very much. I was very impressed of the studies that you've done. We still would need, if we would like to have an access and having reimbursement of this product, that we will still need to have a regulating framework that kind of recognize the impact that your aging clocks have in one way preventing the early aging, and in the other side also guiding to influence and adjust the lifestyle.
Well, I believe this topic has been discussed extensively throughout this conference, and especially in this final word by Dmitry, the potential of longevity trials, and I think you have put together a nice, a lot of information, a nice collection of such trials on your resources. So they are probably right now the best bet when it comes to attracting the attention of the people that need to be in the know as well. And I think they can generate a powerful message. As I said, it is not necessary right now to significantly augment the design of clinical trials to make them longevity trials, right? Because anyway, blood samples are collected in these trials, and it takes very little effort to predict the biological aging rate for all the subjects, and include these as an optional exploratory endpoint, right? So you can say that the primary endpoint is treating osteoporosis, or some kind of
clinical endpoints. Yeah, disease endpoints.
Yeah. Yes. But you can include additional optional exploratory research into these kind of trials, and then if this practice becomes more regular, I believe we would actually be impressed by how many trials might have an unexpected benefit from the longevity medicine point of view.
Yes, so they would be used as a part of the bigger trials to kind of collect some impact of the data they would do. You would think about not having a separate clinical trials, but use them as part of it to generate, right? Do I understand correctly?
Oh, yes, yeah? yes. To complement the existing structure, and once the evidence is there, and people track the success rate of clinical trials either way, and if they see with the corner of their eyes that they're actually also measuring something called biological aging rate. What is that, right? And then this person who is possibly a decision maker, possibly a person somewhere in the high up in the healthcare organization hierarchy, they see this, and and hopefully they see something good and go, oh wow. So this whole longevity medicine thing is kind of big, and seems like it is really promising and can help lots of people, and make the work of thousands of doctors in our country much more efficient. I think I should investigate more. And yeah,
Yes.
so this kind of education, right?
Right. No, I think the education will help in any case. I think we just need to change the perception of the longevity in a lot of ways. I mean, I have this mission into my conference that we planned with Weizmann. I think there is a lot of hype and a lot of misunderstanding of the real value, that longevity, the biomarkers in longevity in general, the research in longevity brings. But I think, I think with having, outcomes of tests that you just shared with me, I think that's already is a quite, a remarkable and tangible outcome. So, I congratulations on this again. Let's see, what is there anybody from the actually panel speakers who would like to ask Fedor anything else?
I just wanted to briefly mention on the topic of longevity medicine that tomorrow, as a speaker, we'll be having Evelyn Bischoff, who, Fedor, I know that you work with.
Oh, yes.
Yeah, she leads one of the leading longevity medicine courses for doctors and physicians, and she'll be with us tomorrow for any interested viewers who would like to delve into the exciting realm of longevity medicine a bit more.
Yeah, thanks. I think we will leave this for the next. Next story is it's anybody from the other speakers in the panel who would like to have other questions, so then I can go and talk and focus maybe on some of the topics that Vijay brought. Is there anything else from any other speakers? Okay, so we go on. I think the clinical practice is anyway a part here. We even have a lot of other speakers who can tell us how the longevity practically in clinical practice have been implemented. Vijay, on your side, I mean, I think you have just also an excellent track record in evaluating the genomics and epigenetics. I think you are the brain and the mind behind the success of Skylight. And so I was thinking, what will be, how do you see eventually, and again, I think we heard also from Jeremy that there is a need for partnerships, and can you tell us what is the challenge now for Skylight, having all of that quite destructive technology that they have, which is to be used by private hospitals and all other institutions. What is the challenge that you see in the research that you are doing currently with Skylight?
Thanks again, Sanya. This is a very interesting question that you ask. What is the major challenge? I mean, in terms of biology, I think each individual is a different cellular machinery, because we all have different complex behaviors, complex molecular profiles, the complex environments we grow in. So at this moment, to get closer to knowing the full truth, we need comprehensive data integration.
Exactly.
And this is something I find a lot of challenges. First of all, we are yet not used to be able to deal with so many multimodal data parameters. Just to give an example, for a given individual, we can have behavioral parameters, nutrition parameters, age, sex, ethnicity variables, genetic sequence, epigenetics, metabolomics, proteomics, and so on and so forth, the gut microbiomes that we learned today. If you could generate a passport where we have each of these features measured for an individual and integrate it for meaningful outcome, only then we are able to talk about personalized medicine or personalized care for a person. So I think the essence of time right now is actually data integration. We need people who can integrate all such data types And this is where the deep learning and AI has a lot of scope. So that next leap forward actually will lie in deep learning. The data is around. The GEO and CBI, all databases are full of data. There have been so many large scale projects. When we publish these big papers, we publish 1 or 2 findings. Rest of the data is deposited in databases. It's ready to be mined. So actually we need people who can just sit through this data, integrate and get meaningful information that's applicable to the majority of population. So this is where I find the biggest leap at the moment, Sanya.
Yes, and that's absolutely, to the point. It is with my experience that I have from big pharma, because big pharma is all owners this type of data, and we have a huge challenge to really connect to the clinical data, to the actual biomarkers. So it has to be a knowledge that exists in terms of utilizing the know-how and the mindset behind the AI technologies. Correct. In really making sense and connecting the dots of this data, so that finally we can build up a very solid prediction programs. Sure. And I guess you are a specialist, and I enjoyed our discussion when you have explained to me, which I thought, okay, that's the critical problem that always the big pharma has. So I guess what we need to work is this cross-sector collaboration, where big pharma realized that there is a know-how and there is everything which is more into the biotech space. It seems like is much more agile and quick. So I guess we will definitely need to go into the same direction of opening the data. And Dmitry is referring to this in his book. I like this humanity-driven idea to say we need to pull all the data that exists and give a chance to the research community to connect the dots and utilize, based on their AI programs and the IP on AI and all their knowledge, then everybody will have the same chance to create something that will going to support the humanity. And I think as soon as we kind of start developing this type of messages, and the book of Dmitry is containing a big part of that, I think that there will be a big policymakers, big initiatives at the WHO and all the companies, because in the end, is impacting not only the AI and not the longevity industry, but also the healthcare in general, all the innovation we are doing. So very glad that you are on this and that we will have you in Switzerland. So we'll definitely increase the innovation number of innovations, in the space of biotech and AI. Thank you, Vijay.
Just building upon what you said, I couldn't agree more with regards to AI and AI specialists being the critical bottleneck. The amount of data out there is mountainous, right? That's not the bottleneck here whatsoever. So at the intersection of that and a lot of Vijay's comments on multimodal data, etc., I did recall a question that was submitted in the Q&A, which asked for examples on human behavioral biomarkers. I assume what they're referring to is, non-biomedical, non-biological biomarkers, things perhaps like psychological aging biomarkers, which I know Fedor touched upon briefly. And I wanted to see, if Dmitry maybe wanted to discuss a little bit about the evolution of digital avatars past 2.0 and 3.0. I know that the concept involves the integration of some non-biological markers, things like regional, financial, even political, as bold as that sounds. I found that to be one of the boldest yet most tangible parts of that chapter in particular, and it segues quite neatly into that Q&A question. So Dmitry, I was wondering if you had any words to share on that matter.
Yeah, Sanya mentioned very important topic about legal framework for clinical, clinical validation. Actually, Frank, your point about there will be much more advanced frameworks which are not now common, but they will evolve very quickly, because two major inputs. Number one, most of really working techniques which are now affordable, available, many of them are actually not very expensive. Some of them quite expensive, but many of them are not expensive. They do not fit under medical treatments. They are mostly fit into what is not actual healthcare. It's about precision health. It's about not anti-aging treatments. It's about to preserve your health in the state of actual health. And for that matter, so the point is that in oncology and many actual disease domains, there are quite well-established biomarkers and well-established frameworks for clinical validation, and that is working very well, and oncology is a very good example. Now, there are a lot of doctors who are not dealing with health, but they're dealing with sick. So it is sick care, not health care. They are not doctors who are preserving health, but they are kind of, like some specialists who are treating some outcomes of initial underlying pathologies, which are actually then evolving into some diseases. Some of them are age-related diseases. When we'll be speaking about actual rejuvenation, like a reversing age, actual elimination of those consequences of pathologies, that will be quite tricky, and that will indeed require quite advanced legal frameworks for clinical trials. However, in my opinion, in the next 5-7 years, there will be a number of particular countries, most likely small technocracy-driven countries, which will want to establish more progressive frameworks for clinical trials in their countries to attract the most advanced, the most sophisticated, progressive biomedical companies to conduct some maybe experimental treatments using those legal frameworks. Now, in regards to digital avatars, every day we are bombarded, and billions of people are bombarded with marketing advertisement being financed by hundreds and hundreds of billions of dollars on a global scale, with some stuff which is kind of considered as if kind of healthy or potentially healthy, or something useful for health or healthy lifestyle, mainly coming from some food supplements or like biovitamins or wellness industry, gym, sports, so on and so forth. There are a lot of coaches, there are a lot of let's say so-called experts who are recommending that this is healthy and this is unhealthy, do this and do not do that, and so on and so forth. But it's their recommendations coming from just from their from their theories, from absolutely abstract stuff. My point is that if there will be designed technology to develop your personal avatar, your personal digital twin based on full assembly of biomarkers, and in my opinion, we will see at least 5 companies by the next year, and probably several tens of such companies providing such consumer-oriented solutions in the next 2 years. So people, instead of listening to some coach or to some advertising, to some marketing, overload of information, they will just see at they will look into their personal digital avatars, namely into their personal biomarkers, and assess for that. They will become CEO, their managers of their own health. I'm not talking about treatment of disease. I'm talking, maintaining your health, because treatment of disease, it's the other topic. It's a little bit different from longevity. So it's about anti-aging treatments, which indeed is much complex, and it will require much more sophisticated, let's say, frameworks. But again, we will see evolution and progress on that matter. Going back to what is, there's access to multiple already now existing technologies. We need a little bit progress, a little bit more consumer-rated solutions from 5 to 10 companies, which we mentioned today several times. Some of them actually spoke here today. I think that deep longevity will be among the first in those list of companies. Tomorrow, there will be several speakers who also are presenting actually consumer-oriented applications. So people will be able to use those applications to actually consider what exactly healthier for their health. I also think that Johnny Adams actually leading the group, which are making some, I don't know to what exact extent he will disclose it, but I'm quite sure for that at least for 10 years, if not more, they are making some kind of research and assessing, safe self-experimentation approaches.
Yes, thank you, Dmitry. I think, the vision of, having, owning your personal biomarkers and having these biomarker avatars, I signed it, it's really sounds something that is visionary in one way, but also very easy to understand because it's a big part of the precision medicine discoveries that are happening. So I think, there will be a lot of progress on that level. And another point that maybe we can close then the panel discussion would be eventually, I think whatever we set, and I think I love the topic about the longevity economy. Yes, longevity economy is really in the matter of, all what has been done and set in a lot of research. Because in the end, the profit here is, and what I said into some of my notes, the longevity dividend is what the society is going to profit by, the individual, but and the whole society. So, how can we, maybe for the people who are still on the line, how do you think that your research and, and also your products are supporting, that imperative of the longevity to eventually transform the investment into positive impact on the economy, and not only in terms of transforming health to wealth, but also generally what would be the contribution that this discovery and growth in the longevity industry can have an impact on the global economy. Well, yeah, we are talking about 15 trillion business of growing old, people say. So it must be, a big impact on the economy. Any thoughts around that?
I suppose I'll go ahead and just state in very general terms of all, longevity industry subsectors, verticals, technologies, etc. I can't think of one better positioned than biomarkers to push forward the continued growth and stabilization, as Dmitry mentioned, of longevity across the board. If you look at methods of optimizing practical healthy longevity, personal health, and becoming CEOs of your own health, etc., formulating and optimizing personal therapeutic and behavioral regimens, Biomarkers of Longevity is it. It's leading the front in that regard. I think it will continue or quite soon lead the front in terms of clinical outcomes in addition to consumer things. Dmitry mentioned quite presciently biomarkers' capacity to create for the first time a really tangible framework to de-risk investments, to make the outcome of clinical trials more predictable, etc. So from that standpoint, it seems to be leading the charge, or at least have high potential to. And there are significant intersections between biomarkers and the longevity financial industry, which I know Dmitry has spoke at length previously about the longevity financial industry being the real bridge to take us forward, and to bridge the so-called longevity liquidity gap, and to bring, high cap institutional conservative investors into play at the exact moment when the longevity industry's continued growth and stabilization really need that. Apologies if I stole some words out of your mouth, Dmitry. I would have imagined you saying quite the same thing.
Franco, thank you. So probably I will add a couple of words here. Approximately in a month from now, by the end of November, we are going to publish the next book. It will be Longevity Financial Industry. We'll assess that industry, and the different constant personal implications, how it's going on now. So we are talking about something between 12 to 15 trillions of dollars per year. Then there will be, after that, there will be next book, Longevity Politics, but it will be not about politics in how it is considered now, but it will be about longevity technocracy, how actual governments and states can evolve towards much more progressive, stage, if they will be focused on preventive medicine to implementation of health longevity for their nations. And we are talking something about from 7 up to 10 trillions of dollars per year. And again, the book will be more about economics, economical implications, either of gaining that longevity dividend or vice versa, declining because of problem of aging population. And this is all about longevity economy. So we are talking about tens of trillions of dollars, whereas actual longevity medicine, longevity science, it's much less compared to those budgets. We are talking about probably around 2-3 trillions, maybe even less per year. But that longevity science, technology, medicine, it's like crucial to for longevity financial instrument, longevity national healthcare systems. Now, for all that crucial, so we when we are talking about tens of trillions, like probably 25 trillions, the point is that 300 companies now currently working in biomarkers. This is the kind of whole grail, I would say. It's the tool, it's the actual leverage, it's the engine, it's the brains who ensure positive, negative outcomes of all those 35,000 entities working in the longevity space, and all those big financial organizations and even entire national budgets. And for example, Japan is one very clear example with very significant aging population and kind of stagnating national economy, just because they had very significant problem of aging population. However, at the same time, their technology, their science, their advances on technocratic angle also quite significant. So that's why I would say they exactly can go either into one direction and fall positive or negative trajectory. So this is again about this longevity economy, which can go either to positive or either to negative directions.
Yes, this is exactly what my thoughts are. Indeed, because it goes a level beyond to the applicability into the investment vehicle goes much level above to the politics and the economy. So I think with this probably we can close the session today, if this is now really within the time, because I think we have set, we clearly outlined the impact of the longevity of biomarkers, setting up the field across all the sectors, with EI actually empowering it, and then I think the book that you have also gives a very clear a request for adding the network and the framework which is needed for all of this to happen.
Well, thank you so much, Sonia, for leading and moderating that stimulating panel discussion. We went significantly over, but I think that's a good thing. And a huge thank you to the participants and the attendees who stuck around for that. Yes, very, very much appreciated.